Yes,
Look,
it works. Hi, how are you?
I'm good. How are you?
I am doing well. I cannot complain. It's Friday.
I
We
know.
made it.
We you look beautiful, by the way.
Oh, you look beautiful. I love your
Thank,
braids.
thank you. Okay, so let's hop into it because I know we've been talking about this and planning this for some time now, and I'm glad that you're the first person I get to have my
Oh,
conversation with. Um, so a little bit about you, Rachell Dumas. You have a nonprofit. You are the founder and owner. You're also a nurse
yeah.
and
Yeah.
originally from Louisiana, right?
Yep, New Orleans.
New Orleans, Louisiana, and you are a
Yes.
mother.
I
Um,
am a mom. Yes.
how old is your little one now?
He'll be 3 at the end of next month. I don't know who told him to continue to grow up. But they tend to do that. So he'll be 3 next month. But
Wow,
yeah,
that is.
yeah. Pray for me.
Um,
I'm a toddler mom.
I know, right? I know.
Yes.
Tell us a little bit about what made you start A Light After Nine.
Absolutely. So I had 9 pregnancy losses prior to finally giving birth to my rainbow miracle baby Nazaire. And it was a tumultuous journey to say the least. There was maternal health deserts, in the sense of not actual facilities because I live in the middle, of Atlanta. We have many hospitals here. But there was a lack of providers who offer the services I need at the points in my pregnancy that I needed them. I was diagnosed with cervical insufficiency, and a cerclage failed at 20 weeks. I had to fly to Texas to get another one placed in to try to save that pregnancy. There was racism and bias at play. There was pregnancies where I went into the ER 8 to 10 times, and then when I finally lost a baby, the doctor asked, "How did you even know you were pregnant?" Things like that. So much I had to navigate, as a patient. Had to put my nurse hat on. I was completing my MSN, well, trying to complete it. I didn't finish it until this year, but I had to put my research hat on to help my providers steer care for myself. Just so much, and I'm like, how are other women navigating pregnancy journeys like this? They can't be doing it effectively. So I also started to think about the maternal mortality rate and morbidity, and I was like, this is why there are so many gaps that I experienced where I had to nurse my way through, or call in a favor, or had somebody who was in maternal health help me navigate really bad situations that I was facing. So I started Light After Nine to give moms and their village, because it's more than just moms, but all the resources I had and didn't have, which was a lot of resources.
I mean, I
So,
imagine like having to have gone through all of that and to have learned so much. And like,
right,
fortunately, you had a medical background, and I can't imagine someone who didn't having to
right.
navigate. And like what a resource it is to offer to so many different people. A huge thing, because I am a therapist and I specialize in perinatal mental health, is
Mhm.
how people's mental health is whenever they're dealing with challenges with trying to conceive a pregnancy or even in postpartum.
Yes.
Can you tell us how important is seeking out mental health support when experiencing loss, or trying to conceive? In your opinion, like what is your perspective about it?
Yeah. So, while I'm in it, you before you even start the pregnancy journey, or even when you are like initially starting, you really, well, I did anyway, and I hear this from a lot of moms. You think you're going to get pregnant, eat some pickles and ice cream, get a few ultrasounds, and show up at the hospital and give birth. Like, in your mind, you're not thinking of pregnancy loss, traveling to another state to save a baby, stillbirths, miscarriage, racism, bias. You're not thinking of all of these things. You're thinking of a very cookie cutter pregnancy journey that won't imply, or won't involve you basically fighting for your life and the lives of your baby. So, in order to even bring my son into this world, especially after all of the grief that I experienced, and we're talking about my pregnancy grief. I lost my mom during this time. I lost my just a lot during this time. Life was still happening,
Yeah.
during this time. I still had to go to work. I miscarried at work. I didn't have time to take the space to grieve the losses a lot of times. So therapy was just not even an option for me. But I started it after my sixth pregnancy. After the pregnancy, I flew to Texas, which I still lost a baby. I was like, this is too much. And I started it then. And I still go every Thursday at 11 o'clock. You never call me because I will be in therapy with Dr. Johnson. But it's just so pivotal. And I also tried hypnotherapy because I had truly given up. Like, I truly had given up. And it was after I finally got my third cerclage outside of pregnancy, and this was like the final thing that could make me a mom. And I had given up. I was like, I just need to try it one more time to see if I can be a mom. I can't leave it on the table. So hypnotherapy really helped
Oh,
me to
wow.
try it again. Yeah. So I had it right before that pregnancy, and I was like, this is the last time. And baby number 10, pregnancy number 9 is now a pot belly 2-year-old toddler. Um, but being on the other side and having gone through that journey, looking back, I always encourage moms. I do a lot of public speaking, and
Mhm.
I always encourage moms, and not just moms, but partners, their village, to start pregnancy before conception, because you don't know what this is going to look like.
Right.
You have no clue. And miscarriage and infertility, stillbirth, all of that, it's more talked about now,
Yeah.
and people were suffering in silence more. They still are, but it's so important that we try to prevent or be proactive more than reactive in
Right.
these cases, especially with therapy,
Right.
especially with therapy. So,
Being that you are another person who's from the South, because I'm originally from Georgia and we're Black and the stigma around mental health. How was it for you in choosing to see a therapist? Like, was your village supportive of it? Was it an immediate thought that you had? I know at first you didn't, but eventually you did.
yeah.
How for you to finally choose? Did someone encourage you, or was it something that you thought of on your own?
Oh, completely on my own. I didn't. I usually don't. I'm not really good at consulting other people with personal decisions that I make. I'm very much a type A Leo. I just do what I need to do. That's just what it is. I really, I don't care about people's opinions. I just, for some reason, I think I was just so focused on having baby, navigating the situation, staying alive at times, that it didn't occur to me, why am I not in therapy?
Um,
Um, I've been in therapy pretty much my whole life, even as a
mm,
child. So it was very organic to just return back. Like, I've just went back. I had used that therapist as a marriage counselor like a couple of years prior. So I just asked her if she would like to do individual counseling because I loved her. She was great, Black woman. Like, we could, we were here.
right.
And she was like, yeah, I can see you as soon as possible. So I saw her the next week. So
Ah,
yeah.
that is amazing. Okay, that's a good thing. And then for you to keep trying, which I think it's also like a testament of who you are, because like not only are you a mother after having trying to conceive for several times and had experienced losses and what a toll that takes on your mental health, but also
Mhm.
you're a very well educated Black woman and,
Yeah.
continuing to masters and then starting a nonprofit and doing speaking engagements. What is that keeps you going? Like, even with trying to expand your family, what kept you going?
Well, in the pregnancy journey, a couple of things. My provider teams and the all of the options that we hadn't explored from early on. At first, the first pregnancy, I was bleeding, went to the doctor, oh, it's a miscarriage. But you'll be fine, you'll have a baby. This happens all the time. So he was so casual about it. I was like, oh, okay, well, I guess, this is supposed to happen, I guess. I don't know. I was a nurse. I am a nurse, but back then I was a trauma nurse, a critical care nurse. I didn't know nothing about birthing babies at the time. I can save a life. Like,
Yes.
I worked at Grady level 1 trauma center here. Like, I will watch the news and go into work, and that'll be my patient.
Wow.
But I didn't know it does not translate to maternal health at all.
Yeah.
So just for context. Um, and then when I got pregnant again during COVID 2 years later, it was twins, and I was bleeding again, and it was like, oh, okay, well, this is a subchorionic hemorrhage, so it was a different diagnosis, but this usually resolves and you'll be fine. Lost the first baby, then it's like, oh, okay, um, something else may be going on. We don't know what it is. So that kept me going, like, well, we gotta find out what it is then. And I lost a second baby. I went to the bathroom and the baby fell out.
Mm.
And then I finally got a diagnosis of cervical insufficiency. So
Mm.
the treatment is a cerclage or a suture or a stitch around the cervix to keep the baby in, which will be removed at closer to the time I go into labor.
Mm-hmm.
I'm like, okay, so now we gotta make it to this point. So it kept being things like this, but we haven't tried this. We haven't tried this. We haven't tried this treatment. You haven't gotten this diagnosis. Well, this doctor does it differently. Oh, we need to try it outside of pregnancy. All these things. And this is over years, right? Like, it's happening. I don't like to leave anything on the table. So I'm like,
Mm-hmm.
okay, well, I had to try that. I don't want to be 40, 50 years old and turn around and like, I could have at least tried that. I kind of just left it on the table. So that was a motivator. Um, and also I had an urge to like a burning urge to be a mom. Like I really wanted to be a mom and to pass on legacy. And that was a driver for me. So it's multiple things.
I love that. I love that. That's amazing. One of the many services that A Light After Nine offers is maternal palliative care integration. Can you tell us a little bit about what that is and why it's important?
Yeah, so I don't offer it myself, but it's a big talking point in my speeches because I speak in front of many clinicians and even clinical students. So before they even touch a patient, it's important to implement this. So like I said, I came from a trauma critical care background where if we had patients dying or had extensive um, just medical journeys and they needed comfort care throughout those journeys, we ordered palliative care. It was just a service that was a no-brainer. But I started to look at maternal health through the same lens. I'm like, why are we not even considering ordering this specialty? Like, it's already at the hospital. It's an easy consultation. They come in, they make a care plan. In a case of fetal demise or maternal, demise, or if you have extensive pregnancy journey like myself, and
Mm-hmm.
they cover things like making sure you're pain free or your pain is tolerable, or making sure your vomiting is under control, making sure your social determinants of health are also addressed along with social workers as well. So we just don't use it for some reason, and it's there. So I always encourage my audience to go back to wherever you work and bring this up. Talk about it with a team. Why are we not using it for these patients? This is an untapped specialty that
Right.
needs to be tapped very soon, very soon. So yeah, I just love to talk about that because we need that. We need
Right.
palliative care. We need those care plans and that extra support, especially now.
I totally agree with you right now. And it's so interesting how we can have all of these blatant resources that are available,
Mhm.
but choose not to offer them or like,
Yes.
make someone's journey less difficult.
Mm-hmm.
Um, and like, you were talking about with like having advocacy and educating. It's unfortunate that times aren't how it used to be where you could choose to have your baby and have a midwife come to your house and you have the baby and all things are well, whereas
Yeah.
now to really like build a village and educate yourself and
Yeah.
advocate and all of these things in order to have a safe birth or just an experience where you can live afterwards and continue on. What
100%.
your postpartum experience like for you after the light after nine
Yes.
occurred?
After
What?
he arrived,
Yes.
right. After he arrived, and I was finally over the threshold. So it was initially the bonding, honestly, was very difficult for me. It was very much for me a patient and nurse relationship between me and my son, because I'm like, okay, he's here. First of all, he went to the NICU very quickly after delivery, so I even questioned. It was kind of like a delirium that I had, and I was like, did I give birth? Like my legs are numb, so I couldn't go to NICU. I'm like not seeing him, and I had 9 pregnancy losses, so I'm like, why am I here? It was such a strange dynamic. It was so strange. So that was an issue. And then once I was like, okay, I can walk. It's 12 hours later. I could walk and finally go to the NICU and see him. I'm like, okay, he's here. There's my last name.
Mm.
you know,
It's very surreal.
yeah. I was like, okay, my breasts are firm. This must be the milk. I was like, it was a very like surreal experience. I'm like, okay. And to hear the nurse say, here's your baby. Do you want to hold him? And he had breathing difficulties because I had to deliver early because I needed oxygen that I did not get.
Oh.
So it's like I'm used to adults with tubes down their mouth and everything and intubated. But to see my child like that, is one of the reasons I've never been a pediatric nurse. So that was alarming
Mm.
to see. But I also was like, let me hold him and try to bond. But it took therapy to really be intentional about um, cultivating a bond between me and him. But for a month, that was my patient and I was his nurse. But he was my favorite patient. My favorite patient. After about a month, and a lot of work with my therapist, I was like, okay, he's not leaving, he's here. And I was like, okay, he's here. I started to give myself permission to be, you know accept that I finally had a baby. And that is something we don't often talk about with recurrent pregnancy loss
Yeah.
at all. Like, and I think even if you don't have, well, I know even if you don't have recurrent pregnancy loss and you have a complicated bonding period, you feel bad as a mom. Sometimes I was told many times by providers, by friends, or even asked, like, do you feel the bond while he's in your belly? I'm like, no.
Right. Because I mean, I would assume that's just a natural coping mechanism after having so many losses. Like, let me not get too attached. I don't know,
Right.
like, how it's going to pan out. And then also, society makes it seem like you had the baby and angels come about and it's just, it's
Literally.
sport. It's not.
Literally, like they was like, well, wait till you hear the baby cry. Baby cry, I'm like, is it an alien? Or I was talking to anesthesia before we rolled back because I had a C-section because I have a cerclagen. And I was like, if y'all told me it was an alien, I'll be fine. If you say it's a baby, I promise you I won't believe you. Like, can you make sure the doctor brings him really close so I can see?
Yes.
Sure it's not ET or something. I don't know what I've been carrying for 9 months. We don't know what's in there.
Yes.
So they're laughing. I was so serious, but that was an issue. And then 6 months postpartum, I woke up blind.
Oh my God, I didn't know that.
I woke up blind. Worst headache of my life, 10 out of 10 pain. I was falling on the stairs. I fell on the stairs with my 6-month-old.
Oh my goodness.
Just sick, vomiting. I just know I was having a stroke. I have a neuro ICU background too. I was like, oh my God, I'm having like a intracranial hemorrhage. Like, I'm like, I need to go to Grady. I didn't go to Grady. I went to um, another hospital. I'm not gonna name it just because of what I'm about to say. And I'm asking the doctor, can we run a, stroke protocol? Like, I can't see you. We need a CT scan, like
And
stat.
like, it's black or it's
It's
blurry.
black. Like, it's black. It's black. I was like, we need a CT scan stat. And he was like, oh, they're full. We have other stroke patients. I was like, sir, I could potentially be a stroke patient. Like, I cannot see you. This is acute vision loss. Like, I'm having a 10 out of 10 headache. That's signs of an intracranial hemorrhage. Like, we don't know. Like, we don't know. This could be early. Like, time is of the essence. Strokes are time sensitive. And he was like, he discharged me saying, it's a stomach bug. You could go take some
A
Pepto-Bismol.
stomach bug.
I promise you. So immediately, I had my husband bring me to another ER. Like, immediately, I was like, we don't have time. We don't have time. Of course, they run a Code Cincinnati, which is stroke workup immediately because of course you do that. And the CT was negative that they did. They did a basic CT. The MRI was negative, but I was still blind. Um, And it took 6 months to get a diagnosis of idiopathic intracranial hypertension. So for no reason at all, fluid just accumulates in my head. Some neurologists have attributed it to the amount of pregnancies, just my body used to retaining fluid. But really, I mean, idiopathic, we just don't know why it happens. They put me on a medicine to decrease the fluid in my brain. 2 years later, this year, I finished my master's degree after 8 years and 3 months. And I finished it on April 30th. May 1st, I was in the hospital. I woke up blind.
Oh my
All
God.
my symptoms came back
Oh my goodness.
with a vengeance. And I'm in the hospital. I was like, can we do a lumbar puncture? We did a lumbar puncture. The pressure in my brain was so high. Like at any moment I could have stroked, like had a stroke. It was so high. It was compressing my veins. We did a procedure called an angiogram, just seeing the patency of my arteries and veins in my head. It was bad. Like the fluid had compressed them so bad. I wasn't even getting blood flow barely on the right side of my brain. I don't know how I finished my master's degree. My brain wasn't even functioning optimally.
Goodness.
Um, and fast forward to June 6th, I had my first brain surgery. All my symptoms went away.
Okay, hold on. June 6th, like this past June?
This past June.
Okay.
I had my first brain surgery. All my symptoms went away immediately. A month later.
Well, hold on. Wait. Pause. How did you feel before going into
Oh,
surgery?
going into surgery?
Yeah,
I was bad.
what was your emotions? Like, were you scared?
Oh,
About
to
with
be
your son?
to be transparent, there were times my son was in the hospital with me for weeks at a time. To be transparent, I was planning my funeral with my friends. Like I picked out my urn. I had a birthday party planned. I told them just turn that into a funeral. You know, I'm from New Orleans. We celebrate. Like just turn that into the into the funeral. I'm getting cremated. Like full plan.
Oh my goodness.
And to be honest, it was so reminiscent of my pregnancy journey, fighting with doctors to get surgeries they said I needed to survive. By the time I rolled back, I could not walk. My kidneys were failing. I could not see. Um, I had vomited for 16 hours prior to surgery. I was sick. And also I was put on this antiplatelet medicine called Plavix, because they want your blood to be really thin, for surgery. Come to find out, I'm genetically an over responder because I love to be unique. Why not? So then I was worried about bleeding out on the operating room table because I had no working platelets.
Oh goodness.
So I was writing letters to my son, and I just was preparing to die because life had got so bad with my symptoms that I just was like, it's either the surgery or death. But I made it through, and all my symptoms went away. But a month after that, they all came back again, and I had to get another brain surgery. And we found an article showing that GLP-1s like Ozempic and Zepbound, stuff like that. There was a longitudinal study from 2004 to 2024 that decreased the pressure in your brain in the first 12 to 24.
Found an article. Who's we?
So there was a pharmacist I was working with, and she had sent me this article about my rare brain disease, and it was over 44,000 people with the same brain disease that I have, and they started a GLP-1, and in 12 to 24 hours, the pressure in your brain decreased, and at the 3 month mark, it decreased mortality, the need for meds, and the need for surgery. So since I started that and had the 2 brain surgeries, I've been great.
Oh my goodness. And that's just like happened to have found the article, to have connected all of that. That is amazing.
Yeah. In addition to, I did post on LinkedIn, and a host of neurosurgeons weighed in on what should have been done, the VP shunt, implants, or whatever. I talked to Dr. Webb at Emory, because I was stuck in Kentucky when all this happened. I don't even live there. I was trying to finish my clinicals for masters. And they helped me navigate that whole situation, advocate for myself. And I'm here because of all those things, the advocacy, the research, the second opinions that I got from these providers. Yeah.
I'm so glad that you're here to be able to tell your story and to share it with others so that they can learn so much from you. I'm so glad that you had a network of providers to be able to work on your behalf, because that's a blessing and that doesn't happen for everybody.
That does not happen for everybody. We know that does not happen often, to have multiple neurosurgeons and neurologists and neuro-ophthalmologists call me while I'm in a hospital in a different state to weigh in on what should be
Yeah.
next. Absolutely. That I've never even met. Some I have, some I have not.
Yeah. Well, how are you today?
I'm great. I wake up every day. I can see. I'm talking to you today. That when I'm sick, I don't have conversations. I can't. I have to be in complete darkness. If I'm not already blind, that is. And I can't be around loud noise. I can't tolerate just a lot. I couldn't be around my child for months at a time. That
Mm.
was hard. And I'm just grateful to be alive today.
Oh, goodness, Rachell. Wow. Um, so we talked about how therapy was a huge support for you, providers, advocacy, education. Were there any other things that you used that helped to get you through it all? Like, was it family, friends? Did you ever do a support group? Was it meditation, prayer, faith? What were some things that just helped keep you going?
I think other people's prayers carried me. Honestly, I had lost faith a lot of times throughout my journey, if we're being transparent. So there were other people who had strong faith that I had to lean on their faith,
Mm-hmm.
borrow faith, I like to say, and borrowed hope. Because when you're in it, you get so tired. You are tired.
Yeah.
Um,
Which
and
I
then to oh
why people give up. Like some
yeah,
people,
that's why people give up.
yeah,
That is why people give up. Because you're already going through a chronic issue, right? My pregnancy journey would be a chronic issue. And then to have my neurological journey, which was a chronic disease that was life threatening at multiple points. It's just like you're tired already of the disease itself. And then you have to prepare to go and prove that you're sick to help multiple healthcare providers to get the treatment that you need. And it's so much worse for Black women,
yeah,
statistically speaking. It's so
yeah,
much worse for us. Um, and like you give up because you're so exhausted. Like if there was another word for exhaustion that was worse, that's what I was. Multiple periods in my healthcare journey at this point. But also after I had my baby during the neurological journey, I was like, well, I can't give up on him. You know, he's here. I fought so hard for him. But at the same time, I just don't know if I can be here. Like if
yeah,
I'm going to survive this journey. So it's just a lot. And then the mental health component of like finally getting over a pregnancy journey that happened 4 years, 9 losses, and being diagnosed with PTSD from that and
yeah,
depression and anxiety, right? And then to jump into another equally or even worse healthcare journey
yeah.
is insane. It's insane. So very little faith, to be honest. Like
Mhm.
they say a mustard seed, it has to be something smaller because mine was, I don't think it was as big as a mustard seed, to be honest with you.
Yeah. How do you feel like motherhood has changed you?
It's, I was already a very hyper resilient person. In some type of way, it's made me more resilient, which is insane to just considering all that I endured before he got here,
Mhm.
which is why I've been counseling all my life, which has helped with that, you know. It's helped with coping, trauma, grief, you know, all those things. But it has also, I am a workaholic. I don't know if you know this about me, but it has it has made me prioritize rest and 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 family more. Um, Especially him specifically in those moments where he has all these milestones and we're celebrating. I just don't want to miss out on life because I'm so focused on all my ventures I'm doing. So it's made me, I'm definitely different.
Mm.
I'm definitely different in a
What
real way.
what is I asked this question because I think a lot about my own sons, and I used to think about, this life that I have to live, but then I thought
Mhm.
about how, so much of my journey was to be able to bring them here because they have
Mhm.
so much to contribute and so
Right.
much experience. What is it that you hope for your son, for his future?
Whatever he wants and whatever his calling is, I just want him to walk into that. Selfishly, if I'm being selfish, I would like him to use his story like I do mine and be a voice of advocacy. Doing all my sickness because I lost my mind. I went to Washington, D.C. With him. I think I posted those pictures and stuff so we could advocate for better maternal mental health resources. We went to Washington, D.C., talked to our senators, our reps, and it was a great experience. And he was there. And I'm like, I want to do this all the time. I want him to be right here, and for people to see this is the product of resilience and having access to maternal mental health resources and being able to persevere. And what happens when we have the policies and the resources that we need to be able to make it through these healthcare journeys. But I want him to go into advocacy. That doesn't have to be his full-time thing, but I hope he's attracted to the good work that you do and I do, that we all do. Um, I also, like 3 weeks after I had my second brain surgery, I started my DNP because I'm crazy. I like torture. So I started my doctorate in nursing informatics.
No, you're not crazy. I
Oh,
said well educated.
okay, well educated. We're gonna go with that one. That sounds a little better. But after my second brain surgery, I started my doctorate in nursing informatics, and I also started a health tech company. I know, because I'm like, no, seriously, I'm like, how are people surviving this? Like all that I had to do for my pregnancy journey, now my neurological journey with 2 brain surgeries and being misdiagnosed with a stomach bug. There are many patients who have been like, well, I guess it's a new bug where you go blind. Y'all have to be careful. You know what I'm saying? They'll go home thinking, oh, this must just be new and the doctor's right. And,
Right, right. And
and they go home.
um, I'm in a African American Studies book club, and we've read
I love that.
Legacy.
Oh,
Um,
yes. Well,
yes,
that's yep.
a Black Sock. Yes,
Yep.
and when she talked about her mother,
I
and
love her. I
when
read it too.
her and how it was like a delayed diagnosis, and
Hmm.
her mother was in the medical field, a doctor herself. And so, yes, please start the company because
Yeah.
it's so unfortunate that we have to do all of this to survive and for the ones who don't get to.
Right, and there's many 250,000 people die every year from misdiagnosis, and we're spending 100 billion annually on misdiagnosis. 100 billion. Do you know how much better our healthcare system could be with 100 billion annually? Do
Yeah,
you know with the big beautiful bill, over 300 rural hospitals are expected to close?
I can.
If we had 100 billion from the misdiagnosis, then we could
Right.
save the
Reallocate those.
hospitals.
Right.
Right, we can reallocate those. So, obviously, but I've created, or I have my development team. We created, are creating an app called Speaker X, where in real time, because this is another thing, we do a lot of education with patients and try to prep them for advocacy in the hospital settings. Being a nurse and being a patient with a lived experience, I have learned that all that goes out the window. If you wake up blind, it just goes out the window. you need somebody right there, and you need somebody knowledgeable. That your caregiver probably is not knowledgeable of a neurological issue that you don't even know that you have. So I created this app giving, again, patients, people, everything that I had during my neurological journey that allowed me to survive this journey and to thrive after it. So on a base level, you can chat in and say, "Hey, my wife, she woke up blind and she's vomiting. She fell on the stairs, and they're saying it's a stomach bug. Something's going on. Can you help us?" And we, in real life, in real time, help you navigate that situation where we're telling you talk to a different doctor, call this unit director. There's another hospital nearby who specializes in neuro. Here's a peer review article to support what we're saying. So don't say that you got this off of TikTok. We hate that. This is what we use to create evidence-based practices in the hospital. This will help strengthen what you're advocating for. Use this too. And then on the second tier, you can in real time talk to a healthcare provider or schedule a call with a healthcare provider in that specialty. So if you're neuro, like what I had, or maternal health, you can even talk to a doula or a midwife. It doesn't have to be like an OBGYN, but if necessary, an OB or a nurse. And on the third tier, you can speak to a legal nurse consultant, or you can speak to a lawyer. We also teach you how to escalate it to Joint Commission, to DPH, to Ombudsman, to that hospital's patient advocacy or patient relations department, because we have what's called an API, where if you put in what hospital you at, we'll do that guesswork to say, oh, this is the number, this is the email. Based on what you wrote in your chat, we've already developed an email for you. Do you want to just send it? You
Oh,
know. So
so
to really help.
the app.
Oh yeah, you can sign up for the wait list. It's coming out next year, early next year, and we're also looking for beta testers as well, and starting research as well to see how comfortable patients are with advocacy and how it's impacting their healthcare outcomes, which we know is very poor.
So
We know it's
what
very
I
poor.
love about you is
Huh?
that what I love about you is that you don't gatekeep. That when you have your own experience, you want to prevent others from having that same experience. From a light after nine to speaker, X app, and just being able to equip people with the tools that they need. That is amazing. And when the app is live, that's going to be game changing.
Yeah, well, my calling is to really help others and save lives. Whether it's a nurse or a patient advocate or a health tech founder or whatever that, a nonprofit founder, whatever that looks like. Um, I just know from the personal experience that I can see how the slope is so slippery where it leads to mortality.
Mm-hmm.
I've been there. I've
Mm-hmm.
been there multiple times,
Right.
multiple times.
How can, if there's a provider that will watch this and wants, or even just like someone who's had their own lived experience and they want to get involved with a Light After Nine or donate or help with fundraising or be a part in some way, what is it that they have to do?
Yeah, you can go on our website, www.lightafter9.org. If you want to participate in the app, we will be hiring 1099 contractors, as well as we have our full advisory and research team already set, but we'll love opinions. So you can go to speakrxapp.com and inquire. We would love beta testers and expertise. We have a fully stacked advisory team, but we would love more opinions as well. And then you can always email me at info@alighafter9.org or info@speakrxapp.com, or DM me on Instagram or TikTok or however you choose. I'm also on LinkedIn. I love LinkedIn. It's like my favorite social media. I'm Rachell M. Dumas, MSNRN. So
Awesome. Okay, so before we wrap up, I have a couple of rapid fire questions for you.
okay,
Random
shoot,
things. All right, would you rather do a beach vacation or a mountain cabin trip?
definitely beach. That's easy. I am not a mountain. If I see a deer, it's stressful. It's not a vacation anymore. I'm just not an animal person outside of the zoo.
Outside of the zoo. Okay. All
That's not me.
right. Michael Jackson or Prince?
Oh, Jesus. Oh my God. I feel like Prince is side-eyeing me right now that I'm even taking this long. Like, you know, the side-eye Prince. Like, we know. You know. Oh my God. Ah. Jesus, I don't know. Can I plead the fifth on this one? Oh no. Oh my God. I'm gonna have to say Michael. I'm sorry, Prince. I love you so much. No one compares. No one. No one compares to you.
Okay, SWV or Escape?
Escape. Just cause that's the first CD I ever had was Escape. One to the arms of the one who loved. I don't know why I was singing that. Don't know. But I was singing it hard. I don't know.
Brandy or Monica?
In what way? Is it
What?
vocal or is it hits like?
Just who's your favorite artist? Like between the two, which one do you prefer?
I listen to Brandy Moore.
Okay.
They're both amazingly talented. Like
Yeah.
pipes are crazy. Like amazing. Shout out to Monica's white sandals.
I know her white sandals when she's sitting on the curb. I know.
I like singing Monica because like she got that very 90s voice like back in the day. Like
Yeah.
I just want to make things right. Like why you saying right like that? Right.
And she's like 14.
Yeah, like why you singing like a grown woman?
Yeah.
Like
Okay. Would you rather go out on a night of the town in Atlanta, do some lounges, or would you rather have a night in, order takeout and Netflix?
I like to be outside. Let me tell you, I have been so sick for years in the hospital. I'm outside.
Mm-hmm.
I'm going outside. I didn't know if the last walls I was gonna see was inside the hospital. I'm going outside. If I could be out the country, I would do that.
No?
But I'm going outside. I'm having experiences. I'm meeting new people. I'm networking. I'm doing speaking engagements. I go outside, and I'm taking my baby with me.
Okay. Well, which one would you rather?
Get me out this house. Right.
Which one
100%
would
get
you
me out
rather
this house.
meet up for brunch? Meg the Stallion or Glorilla?
That's hard. Now, when I'm being innovative, when I came up with my health tech company, I was playing both. I got
You're playing both.
a rap baddies playlist, and that gives me like my empowerment to remember who I am. Because going through like journeys like that, you kind of forget like your power
Yeah.
because you get so weak and stuff like that. So both of them have reminded me who I am. Oh Jesus, Mega Glow. I gotta go with Meg because she's been around a little longer, so I know more Meg songs. But I love Glow, and I'm so mad I was sick, fight for my life in the hospital when it came on tour. I was trying not to die, but hopefully they do it again.
I'm sure they did again. Yeah.
Yeah,
Okay.
live it up after your losses, girl. That's
Oh
my
yes. Yes. Living life. Last question. What song, like if you ever been to a baseball game, at least like Atlanta Braves does this, whenever you go up to pitch or go up to bat, they'll play like their anthem. So everybody has their own like intro walking out song. What would be the song that would represent you?
I've never been to a baseball game ever. Um, I need to go to one just to say I've been. Mine would be "My Power" by Beyonce.
Ooh,
100% My Power.
I love that.
That's
Yeah.
my song. That's my song. I play it every morning, like especially when I'm feeling bad. I have to play a song that Sometimes we just wake up and we just not feeling ourselves, and
Yeah.
that's the song. That's the song.
I'm gonna have to add that to my playlist. But okay. I'm so grateful for your time. Thank you for all that you do. Now I have your number and I can,
Yes. You
stay
can
in
text me,
touch.
call me anytime. Are you in Atlanta?
Am I in Atlanta?
Yeah.
Yes.
Oh, you're in Atlanta.
Yeah.
I knew that. I knew that. I'm tripping. I knew
Yeah.
that.
Remember we saw each other at Emory at the
That's.
around the panel.
I knew that. It was crazy because after that panel, it just went down. After that panel, like it went downhill. But I'm glad to be back up here. I'm so much better now than I
Yeah,
was earlier this year. So
yeah.
yeah, that was April.
That was. Yeah,
Yeah, that
yeah.
was April. Yeah, that was right before. Literally, I was sick during that panel. I
Uh,
was sick during that panel. I wasn't sick, but it was starting to decline during that panel. So it's so interesting. That's why we should give people grace.
I agree. You never know what anyone's going
You
through.
just never know. You
That is,
just never know.
that's true. Well, you look beautiful. Thank you
Thank
for
you.
all that you do. Thank you for all the amazing, innovative things that are coming down. I will definitely follow, and I hope everybody that watches this continue to follow and support you. And you are such a gift to our work in our community. I definitely appreciate everything that you have contributed.
Thank you so much. Thank you for having me. We have to meet up for lunch. We should go to Rumi's Kitchen. That's my place.
Yeah, please. Yeah.
Yes, I was supposed to go there for dinner tonight with one of my girlfriends, but she just canceled because she's tired. So if you want to go, I can meet you there. But yeah,
Yeah, I can't
that's
go, but after this weekend, yes.
I got you. Thanks everybody for joining.
Yes, thank you. Have a good rest of your day, and I'll talk to you soon.
You too. Alrighty.
Bye.